First of all, the hospital and the health industry contributes a lot with regard energy. So the usage of energy is very high in the hospital. Because of that, medical processes are energy intensive. From the CT scan to the MRI, to all of this maintaining equipment, it takes a lot of energy, and carbon footprint is also very high. Talk about solid waste management and the waste that we generate in the hospital, it's also very high to take care of that waste and all of that. So, so you can see now that with all of these things happening in the health sector, especially in hospitals, there is a lot of opportunity to look at how we can solve or even mitigate the effects of these greenhouse gases coming from the consumption of energy. Number one, siguro is, first and foremost, we should be aware that these things are happening and that the health industry is giving so much percentage of carbon footprint. So, siguro at first, awareness. Second, in order for us to measure what we're talking about, it would be good to have an assessment of how much we actually, doctors, as we are contributing to the effects of climate change on health. So while directly we're trying to heal people, we just might actually be killing them with the effects of the greenhouse gases that we release into the atmosphere because of medical and hospital procedures to supposedly treat people. The third would be looking at having known, being aware of it first. Second, having an assessment. Third is to come up with practical programs. Now, this is where the hard part is, because coming up with implementation and action programs is where the meat happens. If there is going to be an alternative to the use of fossil fuels, then that would be one action point that we can look at. Now, having said that, looking at other alternatives and renewables, we know that it's not going to solve the whole problem, but it can be part of a number of solutions when coming together would be big on the decreasing carbon footprint. Climate change is a public health problem, if we will look at it that way, and it affects a lot of other diseases. That's why I would like to become an advocate first. Yun ang aking panawagan sa kapwa kong mga doktor. Be an advocate, learn and understand what climate change is doing to our health. Second, because of being an advocate, you also become an implementer if we help out in the adaptation mechanisms, in the mitigation of these greenhouse gases, in order to improve the health of our hospitals, which are really emitting a lot of this energy and greenhouse gases. Right.